Alberta Health Services. Healthy Albertans, healthy communities, together.
And good afternoon, everyone. I am David Wyant, Chair of Alberta Health Services Board, and I would like to welcome you to this AHS Public Board meeting. Thank you for taking the time to join us. This is a brief meeting, as we only have 3 motions to consider. Before we begin, I would like to acknowledge that Alberta Health Services is on Treaty 6, 7, and 8 territory. I would also like to acknowledge the 46 First Nations communities within Alberta, as well as the Métis and Inuit peoples that we serve in our healthcare system. In my brief introductory comments, I would like to thank, as always, our frontline staff and other health professionals for their outstanding work in helping to respond to COVID-19. I would also like to make a personal comment. I implore any Albertans who are not happy with having to physically distance or to wear masks in public to do so anyway. If you find that a mask is uncomfortable, or you believe that the pandemic is a hoax or overblown and cannot avoid going into public places, wear it anyway and be civil and polite about it. Don't berate the frontline workers. Don't harass retail or restaurant staff. Don't make life miserable for other customers. And don't make yourself a laughingstock on social media. If you feel that you absolutely must vent about it, please send me an email, care of AHS. Now on to the business of our meeting. We are participating by telephone conference today. When I ask for a vote on a motion, I will ask for those opposed or abstaining. For those who neither oppose nor abstain, I will take it that you are in favor of the motion. If there are none that either oppose or abstain, I will declare the motion carried. May I ask that someone move approval of the agenda that has been circulated?
Hugh, I so move.
Thank you, Hugh. Will someone second the motion?
Brian, I second the motion.
Thank you, Brian. Any further discussion? Any opposed or abstentions? The motion is carried. Based on the approved agenda, do any board members have a conflict of interest they would like to declare at this time? Hearing none, we will move on to the motions recommended by our board committees. I ask David Carpenter, as Chair of the Finance Committee, to present the first motion.
Thank you, Mr. Chair. The Finance Committee met on September 17th, 2020. As Chair of the Finance Committee of the Board, I'm presenting one motion for approval today. The committee considered an authorization to spend for AHS from April 1st, 2020 to December 31st, 2020. On June 16th, 2020, the AHS Board approved an interim spending authorization for the period April 1 to September 30th, 2020. Approval of the 2020-2021 budget for AHS by the Minister of Health is not known, but is not expected before September 30th. In the meantime, AHS continues to keep Alberta Health informed of AHS' challenging financial position exacerbated by COVID-19 costs and continues to work on savings and revenue opportunities to improve AHS financial sustainability. This request for authorization to spend in absence of an approved budget is in accordance with Policy 1100, Delegation of Authority and Establishment of Controls for Commitments, which provide that it be supported by written confirmation from the Minister's Office specifying the interim period and the amount of funding to be provided. The committee recommended that the board approve the authorization for expenses, and the board has considered such recommendation, and the members support its approval. Accordingly, I move that the Alberta Health Services Board authorize AHS to incur, firstly, maximum expenses of $11,850,000,000 for the period April 1, 2020 to December 31, 2020, and secondly, maximum capital expenditures of $490 million for the period April 1st, 2020 to December 31st, 2020. I so move.
And Stephen, I second it.
Thank you, David. Thank you, Stephen. Is there any further discussion? Is there anyone opposed or abstaining from this motion? The motion is carried. I ask Brenda Hemmelgarn, as chair of the Community Engagement Committee, to present her 2 motions, or the committee's 2 motions, pardon me.
Thank you, David. The Community Engagement Committee met on September 18th, 2020. Two items the committee considered for board approval are being presented today as they relate to appointments effective October 1st, 2020. These items are with respect to the appointment and renewal of advisory council members and the appointment of trustees to establish foundations. We are very grateful for the commitment of our volunteers across the province. We value their work and appreciate their commitment to health care. As is our typical practice, given the number of appointments and renewals, the names of the members and trustees will not be read in this meeting, but will be incorporated into the minutes of the meeting and posted publicly. First, the appointments and renewals of members to advisory councils. The responsibility to appoint advisory council members lies with the AHS board. The committee recommended the board approve the member appointments and renewals as reviewed by the committee. The board has considered such recommendations and the members support approval. Accordingly, I move that the Alberta Health Services Board approve the appointments and renewals of advisory council members for the terms reviewed by the committee and the Alberta Health Services Board. I so move.
Thank you, Brenda. May I have a seconder?
Hugh, I'll second the motion.
Thank you. Any further discussion? Are there any opposed or abstentions? The motion is carried. Brenda?
Second, with respect to the appointment of trustees to foundations, the responsibility to appoint trustees to establish foundations lies with the AHS board. The committee recommended the board approve the trustee appointments as reviewed by the committee. The board has considered such recommendations and the members support its approval. Accordingly, I move that the Alberta Health Services Board approve the appointments of trustees to health foundations for the terms reviewed by the committee and the Alberta Health Services Board. I so move.
Thank you, Brenda. May I have a seconder?
I'll second. It's Heidi.
Thank you, Heidi. Any further discussion? Any opposed or abstentions? The motion is carried. We've reached the end of our agenda. I declare that the business meeting is adjourned. Thank you again for joining us. Stay healthy, be kind.
Together, we do amazing things every day.